Some years ago, it became pretty clear that we were moving in the direction of having either one newspaper or more likely no newspapers in Colorado. And unfortunately, things are still moving in that direction because the revenue is just disappearing for journalism. And we are trying to provide donor-based news reporting on significant issues that are really important for people to run their government in Colorado and to have a thriving economy in Colorado. And much of that information is disappearing since we've lost about half our journalism jobs in the last 3 years. So this is part of that operation. We started last week with a report on the repeal vote in the House. We talked to all 7 members of the House of Representatives from Colorado, got them on the record on video and audio talking about how they were voting and, more specifically, what provisions in the bills were causing them to vote yes or no on repeal, so that they're on the record about really specific things that are in the bill, not just these phrases or things that people think are in the bill, and did a fact check on some of the things that they said were in the bill that weren't necessarily there, and described the differences between the facts as they are seen by Republicans and Democrats. And Channel 9 used all 7 interviews on their website. They used a couple on the air along with their own. It was picked up by 3 radio stations, several newspapers. And so it's a good first start for our healthcare reporting. So now on to our program. Dr. Michael Pramenko is the head of the Colorado Medical Society. He is also one of the leaders of the healthcare system in Grand Junction and a spokesman for it. Grand Junction has been ranked as one of the highest quality and lowest cost healthcare systems in the nation. We actually did a significant story on a series of stories on them last year, and ranked all of the cities in the United States. We picked up the basic raw data from the Dartmouth Atlas of Healthcare, I think it's called. And you can go on our website and actually see how different cities rank for the quality of their health care and the cost. And Grand Junction was remarkable in that it is high on the quality scale and extremely low on the cost scale. He is also on the Club 20 Healthcare Committee. He's a family doctor in Grand Junction, and he is, of course, getting a lot of notice because of what's happening in Grand Junction and the fact that they've got healthcare reform that's working. So he's on the federal committee for creating healthcare cooperatives. We thought it would be great if Dr. Pramenko could talk about some of the pending and ongoing legislation and what's going on in Grand Junction and how it can be replicated elsewhere. Thank you very much.
Well, I want to first thank you, Ann and Kara and Colorado Public News for allowing me to come over and speak. And it's a real privilege. And plus, I like talking about this topic. So it's such an important element of not only the medical profession, which we're dealing with at the Colorado Medical Society, but the whole economy. And of course, for the patients, because that's really what it's all about. So let me start off with a little piece of Grand Junction, then we'll come back. Back in the early 1970s, the feds passed a bill to allow for the HMO development. And they could be nonprofits. And a small group of docs sat around a table having coffee in the morning, small group of docs, 5 or 6, and said, let's start an HMO. There were some problems in Grand Junction at the time. Medicaid reimbursement was bad then, and there was a problem with access for some of the patients. And so, yeah, there was an element of we need to make this better for doctors, but there was also an element, let's make it better for the patients. So Rocky Mountain, at that time, Rocky Mountain HMO was born with checks written by private doctors to start up that insurance company. Something that right now, without any help, would be difficult to do. Because of the amount of money it's required to start an insurance company these days. 2009 and heading in through 2010 was a rough and tumble one, and oftentimes went away from facts and got into innuendo and sometimes just outright falsehoods. And both parties were to blame for that. That was not one side or the other. We allowed the debate to kind of get away from us, and so it ended up being more of a Jerry Springer thing than really an informative aspect to the debate. We want to talk about the economy because that's really what's driving this. It's not the bill last year. What's driving changes to our health system is the economy. We can't afford to do what we've been doing before. And to meld that with a society that really does want to take care of everybody, for gosh sakes, we allow everybody to go to the emergency room. And as a society, we've sort of agreed upon that. But there's a much, much more efficient way to do that. So we've got to figure out the economy of this and how it can work for our economy. And we want to continue to take care of people, especially at the worst moments in their lives, whether that's a car accident or a cancer. A lot of patients have been feeling like this. And I'll tell you, as president of the Medical Society, a lot of doctors have been feeling like this, even before the bill was passed. There's governments, the state of Colorado, the folks up there at the Capitol feel like this, because that's what's coming down on them as far as the budget. And so, depending on your perspective, the tornado still looks like a tornado, whether you're a patient, whether you're a government official trying to set a budget, or whether you're a physician or anybody else in the system. And if you like Indiana Jones, there's the other analogy of the boulder coming down on you. Let's spend just a few minutes talking about where we're headed at the federal level as far as our budget, because it does relate to the state budget and Medicaid. These graphs are coming from Pete Peterson. He was a Commerce Secretary under two different presidents, one Republican, one Democrat. And he put together these numbers before the bill was passed, and these numbers really didn't change much because the bill, according to the Congressional Budget Office, didn't really change the numbers one way or the other much. Over 10 years, they felt it was $140 billion one way or the other as far as total cost. And you can argue that, but that's CBO. So these numbers were before the bill, but again, they didn't change all that much. And that's the debt we're looking at. 2010, you can see where it goes, largely because of the growing chunk of interest. As the interest gets bigger, everything starts amplifying, largely because of the growing number of people over age 65. Those are our biggest factors. And you can see where if revenue stayed the same, meaning our economy was roughly about the same or averaged about the same over time, there's your flat revenues over time, but primary spending, excluding net interest, because of what's happening to the areas of Social Security and Medicare specifically, that line keeps going up. And even if you took away, the Bush tax cuts and the war, there's a little dotted line there right below there. It doesn't make that much of a difference compared to the amount of money that we're going to have to pour into the Medicare system. So if you're thinking long-term debt, you're thinking interest on the debt, and you're thinking Medicare. So you can see what chunk of that total spending is interest and how that grows over time. Okay? So interest is a big part of that. But what's causing that is the deficit spending. What's a big part of that? Medicare. If we don't do anything, by 2020, the amount of revenue we're taking in can pay for net interest on our debt, Social Security, Medicare, and Medicaid. That's looking at 2020. Go out a bit further, and the money you're bringing in as a federal government will pay for net interest and some of Social Security, nothing else. Now remember, this is revenue neutral. If the economy did what it did in the 1990s, we'd be a whole lot better off. But if the economy does a few more years like we just had, we're going to be worse off. Future Social Security benefits, and this is fiscal sort of long-term promises made. For Social Security, this is in trillions of dollars, kind of goes beyond your sort of comprehension. We're not talking billions here. We're talking trillions of unfunded liability. For Social Security, the promise is about $7.7 trillion over the coming decades. Go down a bit, Medicare, $38 trillion. Medicare is a much bigger problem than Social Security. If you want to start talking where the money is and where we need to work on things, talk Medicare, and you can leave Social Security behind. Actually, Social Security is easy to fix when it comes to what you have to do compared to the complexities involved with trying to change the healthcare system. Medicare, you can raise the retirement age 30 years into the future, and you can do a whole lot to address that. And that's raising the retirement age for people way down the line. But Medicare, we got to change this whole system. That's a complexity that involves so many elements of our economy. That's why you get people talking about Social Security instead of Medicare and health reform, because it's easier to talk about. It's easier to think about. So you get a whole lot of people talking about Social Security, and until recently, you didn't talk much about reforming the health system because it's so complex. We better deal with it now because you can see what the curve's doing between now and 2020 because of the baby boomers. It's hitting the fan, okay? We're going between 2010, you can see how that curve goes up with the huge new increased burden of all the retirees hitting because of the baby boomer population. This is now. This is when we need to address it. And I talk to physicians about this, and I say, docs, you're 17% of the GDP now. Your profession, the healthcare world, makes up 17% of the GDP. And you're concerned that maybe you're losing some autonomy. You're concerned that maybe things are going in directions you don't want to go because you aren't as independent as you'd like to be. If we don't make changes, and we're 34% of the GDP, imagine the loss of autonomy we'll have along the way if we allow that to happen. So come to the table, whether you're a doctor or you're a hospital CEO or you're a CEO of an insurance company, come to the table and start talking about how you can make changes so we don't become 34% of the GDP. Because it's not good for the other parts of the economy. It might be great for healthcare. We're creating all sorts of jobs in the healthcare industry. But half of the money in healthcare industry is publicly funded. So how much does that really help our economy? We want to help the other elements of the economy outside of the health insurance world. And we can do it. There are other countries that aren't socialized that are providing care to all their citizens and doing it for half the cost. So that's what we need to look at healthcare reform. How do we spend less money, do what we want to do, and create a system that's not only good for patients, but good for our economy and creating job growth, which, that's our new governor's all talking about job growth. Okay, so this came out of the jungle. Upton Sinclair wrote about what it takes to change, and there's so many people involved with the healthcare industry.